I'm Diana Allen, chair of the Muskoka Perry Sound District Health Coalition. Recently, we've had a number of nursing stations open in our area, and I'm wondering if there's any information yet on whether they're having a positive effect on reducing ER utilization or hospital readmissions, and whether or not the staff there are being used to their full capability.
I would like to make one comment that, and again, I guess I'm a physician, I'm biased. I'm a big believer in the team approach, family health teams, nurse practitioners, but I'm not a supporter of clinics that are run without some physician involvement. And that seems to be the direction that government is taking as a solution to the problem in rural areas. There may be people in the audience who disagree with me on that, but I mean, surely the answer is a team approach. And as I said in my talk, they've taken away a lot of incentives for doctors to go to rural areas, and probably for nurses as well. And it's been an age-old problem. It's the same now as it's always been. Without some incentives, we are going to have problems. I'm hopeful that the new Northern Medical School, when it starts really producing doctors with a different perspective on life, that will help a great deal in the rural areas. But, you know, that's still to come.
Difference of opinion between itself. As far as the evidence on the quality of care is concerned, but you would certainly also find that RNs and RPNs are great believers in the team approach as well. And I just would like to, while I have before me, one additional point, and that is that when you treat healthcare workers like widgets that can be discarded and brought back, you've really failed miserably, because it takes a very long time to train a healthcare worker and get them involved in the system. And we've been suffering for like a decade and a half from the decisions in the past. And if we make those errors again, you're going to go straight back and cause problems that can persist for a very long period of time.
And Judith, I wonder, would you have a comment on that issue?
I guess
on Arlene's question.
On the nursing station.
No, on doctor's orders being.
Oh, doctor's orders
Yeah.
being. When I heard the question, the first thing that I wrote down was, "It depends," which is a typical Weasley lawyer answer. Because it would depend on what's the order, what's the need, what's the context. So there's a lot of other factors. I need more information. Overall, generally, I could say the CCAC cannot override what is a direction in terms of the health care. And I got to tell you, one of the other things which I didn't talk about is that the Long-Term Care Act, as opposed to the Long-Term Care Homes Act, the Long-Term Care Act, which deals with CCACs, it's not used a lot effectively by people arguing for their rights in the system, because there are appeal rights. There's ways of claiming, if somebody's not getting the proper care, to push for it within the CCAC for a review of the decisions that are made. And if anybody has people who want to do that, we welcome it. The problem is most people won't do it because they're terrified of being labeled as non-compliant and therefore not getting care. So it's a catch-22 a lot of the time. If they fight the CCACs, will they get the care down the line? So that's a complicated issue.
So if I could comment on that just briefly, the role of physicians giving orders to the CCAC group has diminished greatly. We can make the referral, but then the case managers really review the case and decide how much care they're able to provide. But there's one order that I can refuse to write, and I have done so, and that is the discharge order from hospital. If I feel someone is going to be put in a If someone is going to be transported to a facility far away from friends and family, and I know it's going to be adverse to their health, I refuse to write that order, and I've gotten into some difficulty with my hospital administration over that.
Well, what I'll call the legal perspective, we don't want to go after the individual health professionals, but I teach at the Faculty of Social Work, and I say to my social work students, look, this could be professional misconduct. If you're doing something that's the hospital policy that's contrary to the law and contrary to proper practice. And I say that because we get calls from a lot of physicians as well who say, do I have to do this? And I say, well, go back to your own lawyers. I can't provide you with the advice. But it's that pressure's being put on all the different types of health professionals all the line to do things that are really, I think, going to amount to professional misconduct. We don't want to have to go after the professionals. We want to hear, we hope the professionals are pushing back against the policies that actually aren't appropriate.
I think we're going to have to stop there, sorry.